Greetings, this is Dr. Douglas Maurer from iMedical Apps with another medical app review. Today we're going to be taking a look at the latest app from Dr. Joshua Steinberg. This app is called Gout Diagnosis. As I mentioned in my online written review, as a disclaimer, I was a beta tester for this app, so assisted Dr. Steinberg in some content, although I will tell you my assistance to him was likely minimal compared to other beta testers that he used. Let's take a look. So the first thing you see when you open this app is it's available in 5 languages. Dr. Steinberg contacted the developers of the Gout Diagnosis calculator and received their permission to use this into a medical app, and they requested that it be in 5 languages you see here. So let's select Gout Calculator in English. The online example, we had a patient who presented to our clinic, a male. We didn't really specify that he had a prior attack, so let's say he did not. It was acute onset. It had started just that morning upon awakening. He did report joint redness, and it did involve the first tarsal phalangeal joint, or the great big toe. He did have a history of hypertension, and upon review of his labs, he has a history of hyperuricemia, giving him a diagnosis score of 11 points, or a gout diagnosis that is highly likely. You can see in the included chart, if you have greater than or equal to 8 points, you can make a clinical diagnosis of gout and do not have to perform the painful, tedious, and frequently unsuccessful joint aspiration procedure. Similarly, if we make many of these no, we essentially rule out gout, and we don't have to proceed any further with further laboratory workup or joint aspiration because we've ruled out the diagnosis of gout clinically. However, if we get somewhere in between here, an indeterminate score between 4 and 8, the patient may have gout, they may not have gout. In this case, a joint aspiration procedure is needed. So let's look again some directions. The app includes definitions of each of the 7 categories that are part of the diagnostic algorithm, detailed instructions on how to interpret and what to do with the information. What I also like is information about how the actual calculator was derived and validated, information about the study and the authors of the study, and most importantly, some of the statistical information such as the sensitivity, specificity, positive and negative predictive values of using this calculator. And you can see all of that is incorporated here. There's a disclaimer, which is common in many apps, information about the author's ability to contact the developer to give Dr. Steinberg feedback. And then what I really like here is some good information, references about the original studies that went into the derivation and validation of the calculator, as well as some basics on gout. So here's a review article from the American Family Physician, hyperlinked into the app, which I appreciate. There's a number of other references here included. Also some clinical practice guidelines on gout. So some things I liked about this app. I love the fact this is a great calculator that you can put into practice at the point of care tomorrow and really make a difference in making a clinical diagnosis, sparing patients this painful procedure, and potentially side effects of medications that could be prescribed if you don't have the diagnosis proper. It's well referenced, as you saw, hyperlinks throughout, which is nice. It's also available in 5 languages, which I'm sure the original developers who were Dutch certainly appreciate. Some things I didn't like about the app: once you have received this calculation, it'd be nice where you have the points and the likely, unlikely, if it would then give you the sensitivity, specificity, positive, negative predictive value right there on that same screen, rather than having to go into the app here and find that information based on the score, where here you can find it's there, it's just not as easy to get to. There's also not any information in the app itself about how to treat gout once you've made a diagnosis, although several of these references link to primary care management of gout. So it's kind of there, probably beyond the scope of what Dr. Steinberg was going for to include it in the app itself, so I won't fault him for that. The app also is not available in Android at this time. So in conclusion, gout diagnosis, I think, is a really, truly indispensable tool to use at the point of care to make a proper diagnosis of gout. This is Dr. Douglas Maurer from iMedical Apps. Take care.